OB Emergencies. Abnormal presentations in childbirth. When there is a breech, the buttocks or both feet will be present first. For management, prompt for transport, field delivery is not ideal. When delivery is unavoidable, support the buttocks and legs. Do not pull. And if the head does not deliver within 3 minutes, arrange for immediate transport. Insert the gloved hand into the vagina and use your fingers to form a V on either side of the infant's nose. Push the vaginal wall away from the infant's face. Limb presentation is when one leg or arm is protruding from the vagina. For management, do not touch the limb, do not attempt field delivery, and provide supportive care and transport in the knee to chest position. A prolapsed cord is when the umbilical cord presents from the vagina prior to the fetus. For management, provide immediate transport in Trendelenburg or knee-chest position. Insert 2 fingers of a gloved hand into the vagina to remove pressure off of the cord. Keep the cord moist with sterile dressing, and do not attempt to pull the cord or push the cord back into the vagina. Shoulder dystocia is when the shoulders are unable to pass beyond the pubic symphysis. The turtle sign is when the head delivers but retracts back into the perineum because the shoulders are trapped. For management, perform the McRoberts maneuver, putting the buttocks off the end of the bed with the thighs flexed upward, and apply firm pressure with your hand above the pubic symphysis. Transport immediately, even if delivery attempt is unsuccessful. A nuchal cord is when there is a cephalic presentation, but the umbilical cord is around the neck. It is a common finding during delivery and rarely associated with adverse outcomes. For management, attempt to slip the cord over the infant's head. If the EMT is unable to slip the cord up and over the head, clamp and carefully cut the cord. Neonatal resuscitation. For this assessment, if yes is answered to these 3 questions, the infant stays with the mother and standard care continues, including maintaining the newborn's temperature. 1. Is it a full-term gestation? 2. Is there good muscle tone? And 3. Is the baby breathing or crying adequately? If the answer is no to any of the assessment questions, resuscitation efforts should be attempted in the following sequence. In the first 30 seconds of postpartum, the EMT wants to dry the infant, then warm and maintain normal temperature, position the airway, clear secretions, and stimulate. During the 30 to 60 seconds of postpartum, if the child's heart rate is below 100 beats per minute or they are gasping or have apnea, initiate positive pressure ventilation and monitor SpO2. If the child has experienced labored breathing or persistent cyanosis, position and clear the airway, monitor SpO2, and provide supplementary O2 as needed. After 1 minute postpartum, if the heart rate is greater than 100 beats per minute, provide post-resuscitation care. If the heart rate is less than 100 beats per minute, check for chest movement and correct ventilations as needed. Use an ETT or appropriate supraglottic airway. After 1 minute postpartum, if the heart rate is less than 60 beats per minute, begin chest compressions and coordinated with PPV and 100% of O2. Place on an ECG monitor and consider using an advanced airway. 2015 AHA and ECC guidelines for neonatal resuscitation when meconium is present. Suctioning in the presence of meconium staining. A. Vigorous neonates with good respiratory effort and muscle tone born through meconium stain amniotic fluid. 1. Do not benefit from suctioning. 2. Should stay with the mother to receive the initial steps of newborn care. 3. Gentle clearing of meconium from the mouth and nose with a bulb syringe may be done if necessary. B. Presence of fetal distress, poor muscle tone, and respiratory compromise when born through meconium-stained amniotic fluid. 1. Immediately initiate resuscitation efforts. 2. Initiate PPV if the heart rate is less than 100 beats per minute. Umbilical cord management. Delayed cord clamping. Wait 30 seconds after delivery to clamp the cord. It reduces intraventricular hemorrhages. It increases blood pressure and blood volume. It reduces the need for transfusion after birth and reduces necrotizing enterocolitis. There may be adverse findings and an increased level of bilirubin.